Now it is my great honor to welcome Professor Dusan Veshovic, professor at Sanitary Medical School of Applied Sciences, Belgrade, specialist in occupational and integrative medicine, pioneering quantum medicine in Serbia, and creator of the Holistic Health Formula Protocol. Please welcome.
Hvala puno. Thank you so much for the invitation. Should I take that microphone?
Oh, yes, please.
This one is working?
Yes.
Hello, dear ladies and gentlemen, dear colleagues. Is it working? Thank you for the invitation to be here with you today. And after lunchtime, it's very difficult to be awake, so I should start with some joke or some striking breaking news from TV. No, I will skip all of that. I'm going to tell you something from my daily practice, something that's bothering me so much. I'm going to talk about endocrine disrupting compounds. Excuse me. I'm talking about endocrine disrupting compounds. I don't know in your countries where you're coming from, what kind of situation and what kind of insight you have related to endocrine disrupting compounds. But in my country, when I talk with the colleagues, with the physicians, when it comes to endocrine disrupting compounds, all of them says, it's not my area of interest, it's not my business, I'm not familiar with that, I'm not enrolled, I'm not in charge. So everyone has excuse for not dealing with endocrine disrupting compounds. But endocrine disrupting compounds are all around us. And I do believe that if not all, but the vast majority of us face them since the early this morning until this moment, through the air, through the water, through the food. And especially, I think the ladies are endangered because ladies believe that beauty comes from outside, so they put some, lotions, cream, and other things on the skin in a huge amount. And the skin is the biggest organ, and everything is on the skin. It will be immediately in our body with plenty of chemical substances dealing with our body and our hormonal system and our brain, etc. So that exposure, I would say, it's invisible, it's silent, and unfortunately it is unavoidable. I'm not going to tell you something that I expect to eliminate that endocrine disrupting compounds from our environment. It's not possible, it's not that easy. But I'm going to tell you how to think about them, and if you have clinical practice, like I have, to tell to our patients, to tell the people with whom we are talking, how to diminish the exposure of our bodies to those substances. World Health Organization database says that there are more than 800 of chemicals which enters the human body and deal with our endocrine system. If you look at some other data sources, the other data sources reports that there are more than 3,000. But let's stick to that number, 800 chemical substances. And when we see the patient having diabetes or cardiovascular disease or cancer or chronic obstructive diseases of the lung, etc., we need to think about the exposure of that person to endocrine disrupting substances or endocrine disrupting compounds. We, as medical doctors oriented towards Western medicine, are very taught to diagnose, to treat the disease by giving drugs. And sometimes it's not only to give a drug. Sometimes we need to tell living habits in order to eliminate or to diminish exposure of the bodies to endocrine disrupting compounds. So in clinical practice, they are clinical reality. The exposure and the effects of those substances are reality. So in my opinion, it is not a question if we are exposed to them, the question is how much we are exposed to endocrine disrupting compounds. Are you familiar with this topic? Endocrine disrupting compounds. Bravo. So I think that the scientific community, first of all, recognized endocrine disrupting compounds After the accident, let's say, that happened in Lake Apopka at Florida during 1970s, Americans wanted to eliminate malaria, eliminate mosquitoes as a vector of Plasmodium malariae, and they dropped a lot of DDT. And after decades or so, they found that the colony of alligators were different from the time before. What happened? Alligators didn't fight for territory, alligators didn't fight for females, the alligators didn't mate, and the number of eggs went down. And of course, researchers started to do their job, and they found that DDT, after going into the chain of nutrition, accumulated in the organisms of alligators who were at the top of the pyramid of nutrition, and after that, that accumulation changed their metabolism, changed their hormonal reactions, changed them at all. Endocrine disrupting compounds or endocrine disrupting substances, it's one term, and the other term is persistent organic pollutants. EDC can be POP, persistent organic pollutants, but not every POP is EDC. POP means that chemical which enter once environment stay there forever. It's not way to be eliminated from the soil or from the water. And this is a definition by EPA, Environmental Protection Agency. Endocrine disrupting chemicals can interfere with the normal functions of the endocrine system and lead to problems with reproduction and development in both humans and wildlife. WHO says the evidence is growing that hazardous chemicals contribute both to health disorders throughout the life course and to the increased prevalence and incidence of non-communicable diseases such as, and there is the list of those diseases. Endocrine Society reports that scientific statement from 2009 provided a wake-up call to the scientific community about how environmental endocrine disrupting chemicals affect health and disease. I would like to distinguish between those things, endocrine disruptors and hormonally endocrine active substances. Endocrine disruptors are substances which, once enter the human body, may cause harmful effects and can cause the disease. On the other side, endocrine active substances may interfere with the hormonal system, with hormones in the human body, and does not cause the disease. But the line is very tiny. That line is very tiny because they may not cause a disease today, even not tomorrow, but they may cause the disease with a delay of some decades, or may cause the disease in offspring. And we had some kind of, let's say, drugs that we use for decades, and after that they've been banned because daughters or children born from such kind of pregnancies had serious problems with their health, and after that substances were banned. Everybody agrees about this. The greater an individual exposure to endocrine disrupting chemicals, the greater the risk of chronic disease, with the most concern for children, pregnant women, and anyone with a compromised immune system. And I told before that they can be everywhere. They can be in air, water, soil, household products, including children's toy, furniture, and beauty products. These are the list of the most famous one, most researched one. Bisphenol A, used in certain children's toys, plastic bottles, food containers, food can linings, and cash register receipts. DDT, already mentioned. Flame retardants, used in certain furniture and floor coverings. And in foam, memory foam for blankets. No blankets, mattress. Excuse me. PCBs, polychlorinated biphenyls. I will tell you later about them. It's very interesting to see some timeline. Phthalates in beauty products and plastics. Triclosan used in antibacterial products, especially in toothpaste, etc., etc. The list is huge. U.S. Center for Disease Control and Prevention has estimated that more than 96% of Americans have BPA, bisphenol A, in their bodies. And this is a very interesting, for me, timeline. You see here is the date 1979. It is the date when polychlorinated biphenyls, PCBs, were banned in US. 22 years after they were banned internationally by international convention. And more after 3 decades of the use, they were recognized like carcinogenic for humans. I'm not if you're familiar with IRC. IRC is International Agency for Research on Cancer, which is supervised by WHO. And by doing the research, they have a list of 4 kind of classes of different types of activity of some chemicals or other things they investigate. And the number 1 of that list is carcinogenic for human beings. So there were more of 3 decades passed by to recognize that PCBs to be carcinogenic after 1979, when it was the first time banned in US. And these are different types of sources and different types of EDCs coming in our bodies, which are mechanism of actions. There are several. So far, they can bind to hormone receptors. This is the first A, left corner. They can bind to hormone receptors, and they can block some process, or they can activate some process. Also, they can be bind to cell membrane, and it can use they can block signal transduction during, through the cell membrane, or the hormonal transport through cell membrane. Also, they may interfere with DNA. It's here, the lower corner, interact with DNA, and it may cause epigenetic effects. Means in coming time, that person may have some kind of effect or even offspring. On this slide, we may see 2 other mechanisms of action. Here, they can interfere with the production of proteins related to proteins who are the carrier, which are the carriers for hormone, and in that way it may interfere with our normal level of hormones. And the last mechanism described is that they may interfere with the function of liver, and in that way to stop elimination or to increase elimination of our endocrine hormones. So those are the mechanisms, and of course we need to take care about ladies. First, ladies who would like to get pregnant, and pregnant ladies, because not only them, but also fetus in their wombs can be exposed to EDCs, and that EDCs can induce some problems later in life, like it is described here. For example, disruption of endocrine programming and metabolism, obesity. You will see that we are witnesses that obesity is running up nowadays. Changes in metabolism, thyroid dysfunction is also very present in population. Pubertal variants later in life, carcinogenesis. There are many studies about health effects, and that studies are, let's say, are divided in some areas. I am going to pass through all of these areas. For example, reproductive disorders. EDCs, once gets into the body, transforms into the estrogenic-like substances. So they exert some kind of estrogenic effect in both humans and wildlife, in both males and females. So estrogenic properties may cause precocious puberty, and we see that in our practice every day. Prenatal exposure to EDCs, particularly BPA, here mentioned, can induce reproductive malformations, cysts, adenomas, carcinomas, may induce problems with fertility, which is very common nowadays in my country, I believe worldwide. One thing is, of course, exposure to EDCs. They may cause hyperplasia of myometrium, endometriosis, premature ovarian failure, PCO, also very present in population in Serbia. I don't know in your countries what the situation is. And PCO is also a tricky thing, in my opinion, to cure, because it's cured only by using one drug. It's not that easy to cure PCO with only one drug without changing life habits. Implantation failure also can be induced by EDCs. It is found that pregnant women who were exposed to estrogenic EDCs, their sons had cryptorchism with reduced semen quality, subfertility, and testicular cancer. Also, male reproductive disorders is affected. EDCs have been linked to disrupted reproduction function, manifesting as reducing semen quality, infertility, altered fetal development, hypospadia, cryptorchism, etc. Metabolic disorders. Clinical research has also demonstrated that EDC exposure are associated with obesity. Studies suggest that phthalate, for example, exposure could result in approximately 54,000 new cases of obesity in older European ladies. Some other clinical studies have shown that BPA exposure is linked to the risk of insulin resistance and, of course, type 2 diabetes mellitus. And exposure to phthalate also is, let's say, factor that can be related, that can be linked to higher incidence of diabetes mellitus worldwide. Very strange, non-alcoholic fatty liver numbers is in the rise, I see in Serbia. And if you look if that person has some drugs, if takes alcohol in some huge amount, if he takes some fruit with fructose level, etc. No, if he takes some example drug or drinks for energetic drinks, the answer is always no. So maybe we can think that this exposure can be also related to development of non-alcoholic fatty liver. And because of that, of course, some kind of EDCs named here are listed, are classified as obesogenes in humans. Very interesting slide showing that the higher the production of chemical products worldwide during the time, of course, the higher the incidence on prevalence of diabetes mellitus. I believe that it is not the only cause of the diabetes mellitus. There are some other things, but that factor can be contributing factor in the development metabolic disorders, including diabetes mellitus. Neurological disorders, very well described, the cognitive difficulties, abnormal social behavior, learning abilities, lower intelligence quotient in the children born from the mothers being exposed to EDCs. Prenatal phthalate was associated with childhood social impairment. Clinical animal studies have suggested that EDC exposure could impair thyroid signaling and could lead to underactive thyroid gland. And in my clinical practice, I can see that almost every day there is some person having underactive thyroid gland with all the symptoms caused by this lower activity. Cardiovascular diseases is a new field. Children born to women with elevated maternal BPA is found to have higher diastolic blood pressure. Meta-analysis of 33 epidemiological studies show that exposure to BPA was associated with hypertension and coronary artery disease. And what about cancers? We know that cardiovascular diseases and cancers are now the top 2 causes of death worldwide. Approximately 75% plus minus of all deaths can be related to cancers, cardiovascular diseases and cancers. Exposure to EDCs can be contributing factor for the breast cancer later in life. One longitudinal clinical study showed that women exposed to DDT during pregnancy increased their daughter's risk of breast cancer, independent of the maternal history of breast cancer. And one very interesting research for US and Puerto Rico conducted on 50,000 ladies showed that ladies using hair dyes containing that EDCs was associated with increased risk of breast cancer. What about men's? 90,000 participants showed a directly and highly significant correlation between the incidence of prostate cancer and one fungicide, methyl bromide, and 6 different pesticides. In one report, oral contraceptive used by mothers during pregnancy was positively correlated with prostate cancer risk and mortality rate in male offspring. Chronically elevated estrogen in men resulting from allelic variants in aromatase has been associated with the elevated risk of prostate cancer. Those are diseases caused by exposure to different types of BPS, and these are sources of BPS, sources of EDCs, and effects on metabolism. I will try to attract your attention a little bit on some other new researchers. For example, this research is conducted with bisphenol A. It is shown that adolescents with PCOS had markedly increased BPA levels when compared with control group, almost double. This is very interesting study, Hermosa study from California, recent one. Girls who reported recent use of specific makeup products, including foundation, blush, and mascara, had higher urinary concentration of list of EDCs. The use of this toothpaste was associated with 87% higher urinary concentration of triclosan. Triclosan, we said before, it's EDC. Use of sunscreen was associated with 58% higher urinary concentration of one EDC. Very interesting study from China. Almost 1,200 young Chinese men who were screened as sperm donors were taken in account, and researcher found that low sperm count was associated with the quality of water they drink in their cities. A very interesting study. This study is related to gel using for ultrasound, and ultrasound is of course used during a pregnancy for the ladies, and it is found that the ladies usually go to that ultrasound examination have higher concentration of EDCs in the body. So it's a point that ultrasound gel is a potent source of EDCs, and we should be careful about the use. And what we should do with ourselves and with our patient. First of all, we need to be aware of all of this and need to pass the information to our patient. Regarding food and drink, replace plastic bottles and food containers with glass or ceramic alternatives. Avoid drinking hot liquids from plastic. Do not heat food in plastic containers or microwave. 2 minutes more.
Of course.
Replace non-stick cookware with ceramic or glass options. Limit consumption of canned food as can may contain BPA. These are the signs of the plastic. The numbers 1, 2, 4, 5 should be safe. The numbers 3, 6, 7 should be avoided. Home and environment. Minimize use of plastic toys. Choose natural wood or fabric toys instead. Avoid water-resistant textiles, furniture, and carpets. Replace vinyl shower curtains with a fabric one. Filter tap water for drinking and bathing to reduce chemical contamination. Use phthalate-free, paraben-free, fragrance-free personal care products, including shampoos and cosmetics. Use simple products with fewer preservatives, colors, and or synthetic scents. Check labels for triclosan and oxybenzone, especially in sunscreens, and avoid them. And support the body's natural detoxification of maintaining a healthy diet, rich in nutrients, increasing water intake, walk into nature, wood, etc., and considering appropriate nutritional supplements. All of that is written in my book, The Health Formula. These are my contacts if you want to reach out, and I'm bringing you the best regards from the Belgrade. It's capital of Serbia, where two rivers meet each other. River Sava meets River Danube, and then go together. Thank you for attention. Contact. Here we are. Thank you for attention, and I apologize for
No worries.
exceeding time.
Thank you very much for your insightful presentation.